On this video today, we're discussing why you have pain in your shoulder when you're lifting your arm above your head. Hello, I am Siddharth Tambar, the physician at Chicago Arthritis and Regenerative Medicine. On this show, we discuss topics including musculoskeletal health, arthritis, tendinitis, and state-of-the-art treatments for your musculoskeletal conditions. If you have shoulder pain with lifting your arm, that can be disabling when it comes to your exercise, work, and other activity. So let's talk about what's going on when you have pain in the shoulder when you're raising your arm above your head. The shoulder is an amazing structure in the human body. It allows you to move your arm in an incredibly wide range of motion in multiple planes and to do so with stability. That stability is maintained by layers of tissue working in a highly coordinated fashion to provide the stability necessary for that range of motion. At this stage, it's incredibly important to understand the concept of Biotin Tegrity. The idea of Biotin Tegrity is that if you take multiple individual subunits that are distinct and independent, that if you put them in close approximation to one another, under tension and compression, you get a stronger overall unit. In other words, the whole is greater and stronger than the sum of its individual parts. In the case of the shoulder, the multiple units that are involved include multiple joints, the labrum of the shoulder, the ligaments that help to keep the bones connected together, the rotator cuff, the multiple muscles that are involved, the fascial layers in between the muscles and the tendons, and even the nerves as well that supply the muscles and the tendons. So while a healthy shoulder, due to Biotin Tegrity, allows you to have coordination, stability, and durability if any other structures are injured, a shoulder that has had too much injury or chronic injury can then develop instability, chronic inflammation, pain, and functional loss as well. As a physician, how do we determine what structures are injured and what's the problem? First and foremost, there has to be an understanding that it's very rarely just one structure that's a problem because of the layers and depth of tissue that are involved. It's frequently a combination of issues that may be involved. Furthermore, as a physician, I'll look at what's your history of pain, where is your pain, what's your injury pattern as well, what sort of findings do you have on examination, as well as what sort of imaging findings that you have. The kind of imaging findings that I think that are very helpful, ultrasound is incredibly helpful for looking at the shoulder in a dynamic range of motion and manner, where you can then understand what's going on with the rotator cuff tendons, instability in some of the ligaments as well, some degree of joint arthritis as well, and also how do things look in a dynamic fashion and if there's chronic inflammation as well. X-rays can be helpful if you had an acute injury and you want to look at any sort of bone injury. MRI is typically most helpful if you're looking for labral injuries or certain types of bone issues as well. MRI has been used typically also for looking at rotator cuff injuries. In reality, due to the dynamic nature of ultrasound, you can actually get better information about a rotator cuff tear compared to the other side if you're using diagnostic musculoskeletal ultrasound in a skilled and intelligent, nuanced manner. And finally, based on the structures that have been injured, as well as what other conservative treatments have been pursued, additional medical or interventional procedures can be pursued as needed and required. So to sum up, the shoulder is a wonderfully complicated and layered structure. Injuries to it can lead to instability. Instability in turn leads to chronic stress on the injured tissue as well as the surrounding supportive tissue. That in turn leads to chronic inflammation, which then also leads to chronic pain, functional limitation, reduced range of motion, and disability. In a follow-up set of videos, I'll go through what you can personally do on your own if you have shoulder pain to help treat that issue. when you should see a physician, and how a physician can actually help with your shoulder pain as well. Thank you for tuning in. If you found this content valuable, let me know your thoughts. In addition, if you'd like to learn more, check out my other content on this site or at my website, chicagoarthritis.com. Have a good day and live well. Bye-bye.